Empathy is the capacity to understand or feel what another person is experiencing from within the other being's frame of reference, i.e., the capacity to place oneself in another's position. There are many definitions for empathy which encompass a broad range of emotional states. Types of empathy include cognitive empathy, emotional empathy, and somatic empathy. In the development of human empathy, individual differences appear, ranging from no apparent empathic ability, or empathy which is harmful to self or others, to well-balanced empathy, including the ability to distinguish between self and other. Various theories and aspects of empathy have been researched, including empathy within non-human animals. Etymology. The English word empathy is derived from the ancient Greek word mu pi alpha theta epsilon iota alpha. This, in turn, comes from nu and pi alpha theta omicron sigma. The term was adapted by Hermann Lotzer and Robert Vischer to create the German word Einfühlung, which was translated by Edward B. Titchener into the English term empathy. Alexithymia is a word used to describe a deficiency in understanding, processing or describing emotions in oneself as opposed to in others. This term comes from the negation of two ancient Greek words, lambda epsilon chi iota sigma and theta epsilon mu omicron sigma. This combined word is then modified by an alpha privative. Thus alexithymia literally means not having speech for your emotions. Definitions. Empathy has many different definitions that encompass a broad range of emotional states, including caring for other people and having a desire to help them, experiencing emotions that match another person's emotions, discerning what another person is thinking or feeling, and making less distinct the differences between the self and the other. It also is the ability to feel and share another person's emotions. Some believe that empathy involves the ability to match another's emotions, while others believe that empathy involves being tender-hearted toward another person. Compassion and sympathy are two terms that many associate with empathy, but all three of these terms are unique. Compassion is an emotion we feel when others are in need, which motivates us to help them. Sympathy is a feeling of care and understanding for someone in need. It can also be understood as having the separateness of defining oneself and another blur. In the field of positive psychology, empathy has also been compared with altruism and egotism. Altruism is behavior that is aimed at benefiting another person, while egotism is a behavior that is acted out for personal gain. Sometimes, when someone is feeling empathetic towards another, acts of altruism occur. However, many question whether or not these acts of altruism are motivated by egotistical gains. According to positive psychologists, people can be adequately moved by their empathies to be altruistic. Since empathy involves understanding the emotional states of other people, the way it is characterized is derivative of the way emotions themselves are characterized. If, for example, emotions are taken to be centrally characterized by bodily feelings, then grasping the bodily feelings of another will be central to empathy. On the other hand, if emotions are more centrally characterized by a combination of beliefs and desires, then grasping these beliefs and desires will be more essential to empathy. The ability to imagine oneself as another person is a sophisticated imaginative process. However, the basic capacity to recognize emotions is probably innate and may be achieved unconsciously, yet it can be trained and achieved with various degrees of intensity or accuracy. Empathy necessarily has a moralist quality. The paradigm case of an empathic interaction, however, involves a person communicating an accurate recognition of the significance of another person's ongoing intentional actions, associated emotional states, and personal characteristics in a manner that the recognized person can tolerate. Recognitions that are both accurate and tolerable are central features of empathy. The human capacity to recognize the bodily feelings of another is related to one's imitative capacities, and seems to be grounded in an innate capacity to associate the bodily movements and facial expressions one sees in another with the proprioceptive feelings of producing those corresponding movements or expressions oneself. Humans seem to make the same immediate connection between the tone of voice and other vocal expressions and inner feeling. Empathy is distinct from sympathy, pity, and emotional contagion. Sympathy or empathic concern is the feeling of compassion or concern for another, the wish to see them better off or happier. Pity is feeling that another is in trouble and in need of help as they cannot fix the problems themselves, often described as feeling sorry for someone. Emotional contagion is when a person imitatively catches the emotions that others are showing without necessarily recognizing this is happening. Gender differences. The literature commonly indicates that females are more empathic than males. On average, female subjects score higher than males on the empathy quotient, while males tend to score higher on the systemizing quotient. Both males and females with autistic spectrum disorders usually score lower on the EQ and square. However, a series of studies using a variety of neurophysiological measures, including MEG, spinal reflex excitability, electroencephalography and N400 paradigm, have documented the presence of a gender difference in the human mirror neuron system, with female participants exhibiting stronger motor resonance than male participants. In addition, these aforementioned studies found that female participants scored higher on empathy self-report dispositional measures and that these measures positively correlated with the physiological response. Other studies show no significant difference and suggest gender differences are the result of motivational differences. A review published in the journal Neuropsychology found that women are better at recognizing facial effects, expression processing and emotions in general. Men were only better at recognizing specific behavior, which includes anger, aggression and threatening cues. A 2006 meta-analysis by researcher Rena A. Kirkland in the journal North American Journal of Psychology found significant sex differences favoring females in Reading of the Mind test. Reading of the Mind test is an advanced ability measure of cognitive empathy in which Kirkland's analysis involved 259 studies across 10 countries. Another 2014 meta-analysis in the Journal of Cognition and Emotion found overall female advantage in nonverbal emotional recognition across 215 samples. Using fMRI, neuroscientist Tanya Singer showed that empathy-related neural responses are significantly lower in males when observing an unfair person experiencing pain. An analysis from the Journal of Neuroscience and AMP Biobehavioral Reviews also found that there are sex differences in empathy from birth, growing larger with age and which remains consistent and stable across lifespan. Females were found to have higher empathy than males, while children with higher empathy regardless of gender continue to be higher in empathy throughout development. Further analysis of brain tools such as event-related potentials found that females who saw human suffering had higher ERP waveforms than males. Another investigation with similar brain tools such as N400 amplitudes found higher N400 in females in response to social situations, which positively correlated with self-reported empathy. Structural fMRI studies also found females to have larger gray matter volumes in posterior inferior frontal and anterior inferior parietal cortex, areas which are correlated with mirror neurons in fMRI literature. Females were also found to have stronger link between emotional and cognitive empathy. The researchers found that the stability of these sex differences in development are unlikely to be explained by any environment influences but rather might have some roots in human evolution and inheritance. Throughout prehistory, females nurtured and were the primary caretakers of children, so this might have led to an evolved neurological adaptation for women to be more aware and responsive to nonverbal expressions. According to the primary caretaker hypothesis, prehistoric males did not have the same selective pressure as primary caretakers, so therefore this might explain modern-day sex differences in emotion recognition and empathy. Major theories and empirical findings. Research investigating the social response to natural disasters looked at the characteristics associated with individuals who help victims. Researchers found that cognitive empathy, rather than emotional empathy, predicted helping behavior towards victims. Others have posited that taking on the perspectives of others allows these individuals to better empathize with victims without as much discomfort, whereas sharing the emotions of the victims can cause emotional distress, helplessness, victim blaming, and ultimately can lead to avoidance rather than helping. Yet, despite this evidence for empathy-induced altruistic motivation, egoistic explanations may still be possible. For example, one alternative explanation for the problem-specific helping pattern may be that the sequence of events in the same problem condition first made subjects sad when they empathized with the problem and then maintained or enhanced subjects' sadness when they were later exposed to the same plight. Consequently, the negative state relief model would predict substantial helping among imagined set subjects in the same condition, which is what occurred. An intriguing question arises from such findings concerning whether it is possible to have mixed motivations for helping. If this is the case, then simultaneous egoistic and altruistic motivations would occur. This would allow for a stronger sadness-based motivation to obscure the effects of an empathic concern-based altruistic motivation. The observed study would then have sadness as less intense than more salient altruistic motivation. Consequently, relative strengths of different emotional reactions, systematically related to the need situation, may moderate the predominance of egoistic or altruistic motivation. But it has been shown that researchers in this area who have used very similar procedures sometimes obtain apparently contradictory results. Superficial procedural differences such as precisely when a manipulation is introduced could also lead to divergent results and conclusions. It is therefore vital for any future research to move toward even greater standardization of measurement. Thus, an important step in solving the current theoretical debate concerning the existence of altruism may involve reaching common methodological ground. Contemporary neuroscience has allowed us to understand the neural basis of the human mind's ability to understand and process emotion. Studies today enable us to see the activation of mirror neurons and attempt to explain the basic processes of empathy. By isolating these mirror neurons and measuring the neural basis for human mind reading and emotion sharing abilities, science has come one step closer to finding the reason for reactions like empathy. Neuroscientists have already discovered that people scoring high on empathy tests have especially busy mirror neuron systems in the brains. Empathy is a spontaneous sharing of affect, provoked by witnessing and sympathizing with another's emotional state. In a way, we mirror and mimic the emotional response that we would expect to feel in that condition or context, much like sympathy. Unlike personal distress, empathy is not characterized by aversion to another's emotional response. Additionally, empathizing with someone requires a distinctly sympathetic reaction where personal distress demands avoidance of distressing matters. This distinction is vital because empathy is associated with the moral emotion sympathy, or empathetic concern, and consequently also prosocial or altruistic reaction. Empathy leads to sympathy by definition, unlike the over-aroused emotional response that turns into personal distress and causes a turning away from another's distress. In empathy we feel what we believe are the emotions of another, which makes it both effective and cognitive by most psychologists. In this sense, arousal and empathy promote prosocial behavior as we accommodate each other to feel similar emotions. For social beings, negotiating interpersonal decisions is as important to survival as being able to navigate the physical landscape. Emotions motivate individual behavior that aids in solving communal challenges as well as guiding group decisions about social exchange. Additionally, recent research has shown individuals who report regular experiences of gratitude engage more frequently in prosocial behaviors. Positive emotions like empathy or gratitude are linked to a more positive continual state, and these people are far more likely to help others than those not experiencing a positive emotional state. Thus, empathy's influence extends beyond relating to others' emotions. It correlates with an increased positive state and likeliness to aid others. Measures of empathy show that mirror neurons are activated during arousal of sympathetic responses, and prolonged activation shows increased probability to help others. Another growing focus of investigation is how empathy manifests in education between teachers and learners. Although there is general agreement that empathy is essential in educational settings, research has found that it is difficult to develop empathy in trainee teachers. According to one theory, there are 7 components involved in the effectiveness of intercultural communication. Empathy was found to be one of the 7. This theory also states that empathy is learnable. However, research also shows that it is more difficult to empathize when there are differences between people, including status, culture, religion, language, skin color, gender, age, and so on. In order to achieve intercultural empathy, psychologists have employed empathy training. One study hypothesized that empathy training would increase the measured level of relational empathy among the individuals in the experimental group, when compared to the control group. The study also hypothesized that empathy training would increase communication among the experimental group, and that perceived satisfaction with group dialogue would also increase among the experimental group. To test this, the experimenters used the Hogan Empathy Scale, the Barrett-Leonard Relationship Inventory, and questionnaires. Using these measures, the study found that empathy training was not successful in increasing relational empathy. Also, communication and satisfaction among groups did not increase as a result of the empathy training. While there didn't seem to be a clear relationship between empathy and relational empathy training, the study did report that relational empathy training appeared to foster greater expectations for a deep dialogic process, resulting in treatment differences in perceived depth of communication. The environment has been another interesting topic of study. Many theorize that environmental factors, such as parenting style and relationships, play a significant role in the development of empathy in children. Empathy promotes pro-social relationships, helps mediate aggression, and allows us to relate to others, all of which make empathy an important emotion among children. A study done by Caroline Tizzo looked at how a variety of environmental factors affected the development of empathy in young children. Parenting style, parent empathy, and prior social experiences were looked at. The children participating in the study were asked to complete an affective empathy measure, while the children's parents completed the parenting practices questionnaire, which assesses parenting style, and the balanced emotional empathy scale. This study found found that a few parenting practices, as opposed to parenting style as a whole, contributed to the development of empathy in children. These practices include encouraging the child to imagine the perspectives of others and teaching the child to reflect on his or her own feelings. The results also show that the development of empathy varied based on the gender of the child and parent. Paternal warmth was found to be significantly important, and was positively related to empathy within children, especially in boys. Interestingly, however, maternal warmth was negatively related to empathy within children, especially in girls. Applications. The empathy-altruism relationship also has broader practical implications. Given the power of empathic feelings to evoke altruistic motivation, people may unfortunately learn to suppress or avoid these feelings. This numbing or even loss of the capacity to feel empathy for clients may be a factor in the experience of burnout among caseworkers in helping professions. Awareness of this impending futile effort, such as nurses caring for terminal patients or pedestrians walking by the homeless, may make individuals try to avoid feelings of empathy in order to avoid the resulting altruistic motivation. Promoting an understanding about the mechanisms by which altruistic behavior is driven, whether it's from minimizing sadness or the arousal of mirror neurons, allows people to better cognitively control their actions. However, empathy-induced altruism may not always produce prosocial effects. It could lead one to increase the welfare of those for whom empathy is felt at the expense of other potential prosocial goals, thus inducing a type of bias. Researchers suggest that individuals are willing to act against the greater collective good or to violate their own moral principles of fairness and justice if doing so will benefit a person for whom empathy is felt. On a more positive note, empathically aroused individuals may focus on the long-term welfare rather than just the short-term of those in need. Empathy-based socialization is very different from current practices directed toward inhibition of egoistic impulses through shaping, modeling and internalized guilt. Therapeutic programs built around facilitating altruistic impulses by encouraging perspective-taking and empathic feelings might enable individuals to develop more satisfactory interpersonal relations, especially in the long term. At a societal level, experiments have indicated that empathy-induced altruism can be used to improve attitudes towards stigmatized groups, even used to improve racial attitudes, actions toward people with AIDS, the homeless and even convicts. Such resulting altruism has also been found to increase cooperation in competitive situations. Types. Affective and cognitive empathy is generally divided into two major components. Affective empathy, also called emotional empathy, the capacity to respond with an appropriate emotion to another's mental states. Our ability to empathize emotionally is based on emotional contagion, being affected by another's emotional or arousal state. Cognitive empathy, the capacity to understand another's perspective or mental state. The terms cognitive empathy and theory of mind are often used synonymously, but due to a lack of studies comparing theory of mind with types of empathy, it is unclear whether these are equivalent. Although science has not yet agreed upon a precise definition of these constructs, there is consensus about this distinction. Affective empathy can be subdivided into the following scales: empathic concern, sympathy and compassion for others in response to the suffering, personal distress, self-centered feelings of discomfort and anxiety in response to another's suffering. There is no consensus regarding whether personal distress expresses a basic form of empathy or instead does not constitute empathy. There may be a developmental aspect to this subdivision. Infants respond to the distress of others by getting distressed themselves. Only when they're 2 years old do they start to respond in other-oriented ways, trying to help, comfort and share. Cognitive empathy can be subdivided into the following scales: perspective taking, the tendency to spontaneously adopt others' psychological perspectives; fantasy, the tendency to identify with fictional characters; distribution. A difference in distribution between affective and cognitive empathy has been observed in various conditions. Psychopathy and narcissism have been associated with impairments in affective but not cognitive empathy, whereas bipolar disorder and borderline traits have been associated with deficits in cognitive but not affective empathy. Autism spectrum disorders have been associated with various combinations, including deficits in cognitive empathy as well as deficits in both cognitive and affective empathy. Schizophrenia, too, has been associated with deficits in both types of empathy. However, even in people without conditions such as these, the balance between affective and cognitive empathy varies. A meta-analysis of recent fMRI studies of empathy confirmed that different brain areas are activated during affective perceptual empathy and cognitive evaluative empathy. Also, a study with patients with different types of brain damage confirmed the distinction between emotional and cognitive empathy. Specifically, the inferior frontal gyrus appears to be responsible for emotional empathy, and the ventromedial prefrontal gyrus seems to mediate cognitive empathy. The Interpersonal Reactivity Index is the only published measurement tool to date that accounts for a multidimensional assessment of empathy. It comprises a self-report questionnaire of 28 items, divided into 4 7-item scales covering the above subdivisions of affective and cognitive empathy. Other types. Somatic empathy is a physical reaction, probably based on mirror neuron responses, in the somatic nervous system.